And that's what I do, like in consultations. I try to get to know people, and it really helps me to remember, you know, their stories and what they want to achieve. And I try to be an advocate when I go into the operating room. I try to remember all the things that they tell me, their desires or preferences for whether they want their nose just a little higher or lower, or with a little bit more of a slight curvature. And you know, I always ask people, you know, if you had a preference, would you rather have this or that? And those things really help me when I try to make those decisions as an advocate in the operating room. Well, you know, I think with every job that you do, if you don't have that human component, it's just going to be boring. And I'm not saying that in a sense that, oh, I'm trying to be a martyr, but I think if you don't have that emotional component with your patients or your line of work, it could be a pretty painful experience in your job. You know, I think getting to know people is huge. I've learned so many things. Like I've been working on this piece discussing self-harm injuries, and when I think about that, I think of all the stories that people come, you know, in and tell me, and they're just quite fascinating. Like some of the pain that people have gone through to lead to those things, you know, and this is just like one facet of our, you know, of our practice. But we, you know, I love spending time, like when I do the consultations, getting to know people. I've learned so many things from people. And I personally feel that humans are just so, there's so many elements of humans. They're just so brilliant that my thought is that with people, you can learn so much from every single person. I try to, and during the consultations, I try to learn, you know, from people in whatever they're doing. You know, and every person has their own life that they've just devoted like all their, you know, obviously their energies in their own life. And they get immersed in their line of work and their lives that you just can learn so much from someone else. And I think, you know, from learning about their favorite restaurants to learning about this mountain pine beetle in Canada that just destroys all these trees, you know, to learning about how someone comes to the decision to actually hurt themselves to release this pain that they're having. Like, I remember talking to this person that witnessed one of their family members dying in front of them, and that leading to this period in their life that they had all this pain, that they had to injure themselves. But before that, I couldn't even understand why someone wanted to do that. It's amazing. I think with plastic surgery, there's this human element that you get to delve into. It's not like finances where you're just talking about numbers and like how to invest well. And maybe some, you know, in some other professions, people like spend time to get to know people. But I think with plastic surgery, it somewhat can be a really personal thing. Like, especially if you're going to operate on someone's face, it's so personal and you know, obviously really important because you can just change their lives. So it's been really fun to just like learn from people, and I'm constantly learning. I feel like there's so many things that I can learn about myself, and I'm constantly doing that. I'm self-reflecting and maybe a little bit more self-conscious than I should be, but you know, it's part of, you know, learning in life. You know, I'm constantly learning about, you know, self-help and emotional intelligence, and reading about this book on happiness and by Matthew Ricard, and trying to incorporate those things in my life, and also my work too. I'm far from perfect, but I'm always trying to get better.